running about 10 minutes ahead. If you've got all people with you, just don't slow her down. Good to see you. All right. Good to see you. Sheriff Hall, if you want to introduce your colleagues, you're more than welcome at this time, and then make any statements you need to make.
Yes, sir. Thank you, Mr. Chairman, and thank you for having us here. I brought Mr. Pete Lutz. He is our Director of Finance for the Sheriff's Office, and our Chief of Administration, Mr. John Hudson, and some others that are in the back. And I want to thank the men and women who are over there working and all over the county for us right now so we can all be here. So we're here in budget season, as I have each of my 15 years to report that we are under budget and going to be within the money you gave us last year, something we try very hard to do. I will tell you, this is the hardest year that for us that I've been around and trying to do that, just with a lot of different challenges. One of the things that I'm most proud of that we have been working on for those 15 years as we remain the most racially diverse organization in metro government, large organizations in metro government. We've strived very hard to do that. It's part of our mission statement we started 15 years ago, and very proud of where we sit today as it relates to reflecting our community. The Sheriff's Office has been in a state of transition. If you haven't seen it, I'm sure you have across the street, but 12 months ago, as we started to close a lot of the facilities, we've moved nearly every inmate that was in our custody. We've also moved nearly every staff member in some form or fashion. They have been relocated and asked to do things they've never been asked to do before in different locations, and I'm very proud of the work they do every day, and knock on wood, without incident. We've had a really good year of managing a very difficult situation. Of course, the generation that's next is that there are new facilities on the way that will help everyone in this community, and so looking forward to those days as well. But also in the last 12 months, we have become reaccredited, or successfully were reaccredited. One of the few organizations in the country that do what we do, that have everything accredited by the American Correctional Association, and very proud of that in a very difficult year for us to get that. As you guys know, sometimes it lands on the years you don't want it to. This was one of those years. I'm very proud of the outcome of that report. One of the things that my passions, and one of the passions the last 2 or 3 years, is to try to do something about decriminalizing the mentally ill. We're working very hard, and have been for the last couple of years, of not only identifying the problems where people who are mentally ill being brought to the criminal justice system, but what can we do about it? And we have a two-pronged approach to doing that. First, we are designing a building that will allow us to divert people. That's fantastic, because ultimately they do not belong in jail. Most people who are ill, you would never think to send someone who has cancer or a heart attack to jail, but for some reason, mentally ill people are sent to jail oftentimes. So we're going to have a diversion unit that will come out of the ground, as you see across the street, that will allow us to be one of the only ones in the country doing such a thing. And that's a good thing. And long term, it should help Nashville dramatically. But something that you won't see, but I want you to know about, we took money out of our last year's operating budget to certify every officer that deals with mentally ill people. It's called a correctional behavioral care certification. We're the only place in the United States that's doing that. To be working with this population, you must be certified. Very intensive. It takes 6 weeks. You go through 40 hours of training, then you're tested, and then you have 6 weeks to complete the work. Very, very proud. I tell people all the time that we expect a lot of our officers that do that work. It's our job to give them the tools to do their job, and quite frankly, we weren't doing very good at that. So your folks are better trained today. They will be going forward. The liability reduction for the city is tremendous, but also they feel a little proud about the work they do because they have better tools to do it with. So very proud of that effort we've taken on the last 12 months as well. Something that is a budget issue, talk with Talia and talk with the mayor about this over the last several months that I do want you to know about is we renegotiated our phone contract, that's the phones that are in the jail facilities. I've always philosophically had a problem with the government making commissions off of families of incarcerated people. It's tough enough on the individual and the family to be in jail, but when the loved one who is receiving the phone calls are having to pay, that's tough. But a lot of communities, and this community did it for a long time too, really generates commissions off of those phone calls. And so what we did was we went and renegotiated that with the company, and the only cost that the person is bearing now is the cost of doing business. There is no commission. The government doesn't make money on it. And I think that's better for all of us, and it surely takes the burden off really the less fortunate, the difficult person who's in the system. There's other reasons why we want to do that. Maintaining phone contact between someone who's incarcerated and someone who is in the free world is a critical link to staying out of jail. It's proven by research that I need to maintain relationships with my church, my family, my job. And so when you start to limit that by costing and charging a lot of money to make such a service, we reduce the chance that they're going to stay out of jail. And so we renegotiated that last year. It does have a budgetary impact. It's identified in your budget. But it's the right thing to do for Nashville, I think, and I hope you'll agree with me. There's also something that was released in the news media in the last several months. We also are one of the few places in the country where every inmate who's in our system has a tablet, very similar to what you would call an iPad, and that's not to make it soft and frilly and fun in jail. We're not doing that. But it is important that they maintain steady relationships. We approve who they communicate with. It has to be through a system. But they can maintain those relationships in a very similar way to what you would in the free world. Today's young person doesn't communicate the way I did when I was 20 years old, and if I was buying old dial phones and hanging them on the wall and asking them to dial home, they wouldn't have a clue what I was talking about. And most systems are moving away from that and making it more independent. An individual sitting in a cell right now can be communicating with someone who we've approved them to communicate with in the various means that you and I may be familiar with, texting and so forth. They cannot text victims. They cannot text their charge partners. They can't text other people. It would be only people approved through us. That's how we've always done the phones, just so you know. But we're moving away from the standard phone use. Several reasons for it. One, the individual has their own relationship and their own ability to communicate. They're not waiting in line and fighting over telephones. We've had histories of problems with that. And quite frankly, we can now allow on that device educational material, religious materials that they want to purchase or buy. They can have things that they can learn, apprenticeships, working on various programs at their own discretion, if you will, within their own bunk while they're there. They're not having to wait for classes to start. It's less movement for us. It's a safer place to live and work. And quite frankly, allows individuals to stay connected with the outside. And so we think it's a very important part of a person who's going to reenter our community. So we're working very hard to do that. It is a budgetary revenue loss, but I'll be happy to discuss that and hopefully anything else as you will. So, Mr. Chairman, entertain any questions.
Councilman Glover.
Thank you, Chair. Sheriff, good seeing you. And as always, I don't ever remember a time you come in that you don't come in below budget. So that's greatly appreciated. There's really not a lot I want to ask you on this. We haven't seen the capital improvement budget yet. Is there anything that we need to have our eye on for next year? Because I think this coming year, if I remember, is it this coming year or is it the year after that that's going to be a rather expensive transitional year again for you?
It should be the next year.
Okay,
and again, and I haven't seen it either, but in discussions with the mayor's office and administration, I think the monies you're really talking about would be in general services budgets, but very important, something we're anxious to see as it comes out as well. This year is transitional, and we're in a pretty good situation, but there's a lot of pieces to that moving target, a very large transition back, let's say 12 months from now. But I think we're pretty steady as long as those capital monies that are expected come out. It shouldn't cost you any money until the following year as it relates to transitioning back.
Okay, and the funds that we gave last year with regards to the facilities where you have everyone housed now, was it sufficient in order? I'm assuming it was, because I'm not sure that all of that was operational.
Yeah, I tell you what, and I've said this internally. I said it as late as yesterday to our staff, and we were out there doing something. That campus has never been more secure, and it happened in an abrupt way, if you remember how all this happened. But quite frankly, it turned out to be a very good situation. We're very secure there, our staff and the families. We've really been able to enact some things from bus lines and so forth. So, you know, knock on wood, in our line of work, we're measured by failure. And so as long as you haven't heard much, we're doing pretty good. So But we're going to hold our foot to the ground on how to run that operation in this temporary phase. And then ultimately, we want to be back down in the new facility and, of course, making that site out there back to what it was.
Okay, and then I want to ask you, and I don't know that this, so, Chair, I'm going to ask just a little leeway on this because I'm not positive it's budgetary. I don't think there's a member that sits out here, especially as district council members, that doesn't pick up the phone and call your office or email you or text you guys in one way or another to help with either a trash pickup or a mattress or something along that nature. Do you have the materials that you need? I know there's been kind of a shortage of workers, as it were, because of some of the proactive things that you've done. Is that still in place? Is there anything that we can help in that arena on?
You know, I don't think we need anything right now as it relates to equipment. One of the things that's improved dramatically in the last 10 years, as long as I've been coming up here, is kind of this, kind of the fleet needs. For a long time, that was complicated by just not a very good system. I think that's improved dramatically. And I don't know of anything that we could help you more with. There is an issue about work. We're trying to get people treatment for addictions and mental health, and also get them to work and teach them a skill. And
that's a good thing, yeah.
Right. You spread that out, and we don't have as many labor force workers, if you will. But I think we're finding some creative ways to help in that way as well. But I appreciate you asking, and we, we're aggressive in trying to get people out of the cell and go do something productive. If that's helping the community, that's a good thing. They like it, you like it. It's good for all of us. But we also want to arrest the addiction that brought them there, and it's sometimes the balance of those things we're trying to keep a fair gauge of.
All right. Thanks, Sheriff. Chair, thank you.
Councilman Hurt.
Thank you, Chair. So, to Councilman Glover's, the loss of the litter grant, so that will not affect your ability to continue to clean up?
It won't hurt you, and it hurt us. We've got some issues about, the accounting of all that, but it won't hurt our workforce. And, Mike Raines is in the back. A lot of you guys know is critical to that, and they do a great job. And we're working right now with, and I hope, and I think you guys will have this in front of you, with a program called Steer and Clear with the Public Defender's Office. There's an element to that program that, and you're very familiar with this as well, but there's an element to that would allow you to go work community service hours.
Right.
And what we're going to do is take that opportunity and let Mike and his operation use more workers through that. And so we believe we'll be able to bring more work to the community.
Oh, excellent. And in terms of the tablets, is there a way that you'll be able to monitor the usage? Can you explain that?
Yeah, by the way, I should have said this. I will get calls, and I get some negative Facebook and Twitter people and all that. Let me get this straight. You can't stream. You can't get on Facebook if you're incarcerated. You can't. Let me be the incarcerated person, and you and I are wanting to communicate. What's interesting about this is you, in the free world, have to set up an account, and I would communicate to the account. Then you can go to the account and see what I've said. I can't go directly to you. That's to protect you and the community, and it's also to allow. And the other thing that's very interesting is that communication is delayed by several hours. It's in the neighborhood of 8 hours. So I can't say I'm on my way to the hospital and you're ending up at the hospital with me. So when I communicate it, that's 8 hours behind when I really did it. So there's security apparatus built in it, so the community is safer. But the individuals that are using the tablets, what we're trying to do is to, and if you imagine all of us now live virtually everything from what's the weather to where's the GPS and where's my work, my phone numbers. And so it's allowing that to maintain a continuation in the community. But we're trying to obviously be sensitive to the security issues in the community.
So each individual inmate will not have a tablet, but they will have access to one.
No, everyone's handed one when they get there, and then we approve everybody. I would have to give my names of people I want to communicate with. I would say Councilmember Hurd is one of those. We would approve that to make sure that it's not someone linked to any other situations with you. And then we're free to communicate.
Well, I know the reason why I'm asking is because I know some people are not technologically inclined.
Right.
So if they do not want it.
Yeah, they don't have to. That's a good question. I had a retired judge call me last week and said, hey, I've got a whole bunch of books to give people who want to just read the books, because some of us are old-fashioned. We don't want to do the device.
Right.
Yeah, we haven't taken anything away. This is in addition to what they have.
Okay.
Yeah.
Councilman Cook.
Thank you.
Thank you, Mr. Chairman, and thank you, Sheriff, for being here. If you didn't mind, would you just talk about the achievement of accreditation and What does that entail? Feel free to brag, and our evaluation and how we compare. Thank you.
Yeah, it's through the American Correctional Association, and it started historically with jail facilities themselves. That's the most difficult thing to do. All of our jails have been accredited. We're one of the, I think there's about 3 in the United States that have every facility accredited in a city this size. And we also went forward and had our training academy accredited, standalone training center, and our administration building. And so that's kind of grown in the last 10 years. It's some 400 and something standards you have to meet, everything from how many foot candles of light are in the facilities to, everything from how many hours everyone in the world is trained and so forth. This was a reaccreditation for us. It's about the 3rd or 4th time we've done that. It's an every 3-year process. To be honest with you, reaccreditation is more difficult than the original one for us because you're having to maintain documentation on all the proof that you're doing that. But we take a lot of pride. These are nationally accepted standards, and we want to reach that standard and, if not, exceed it. And as I said a long time ago, we want someone else to help give us the bar to reach, not to create it ourselves. And so I'm very proud of that. Our staff work, as you can imagine, it's a nervous time, week-long process for everybody, and they go over everything you do. From paperwork to they go through 24-hour day shifts. They interview inmates and families and staff and ask them how does it operate, and then they balance that against the policies to make sure that as we say, our practice matches our policy.
Well, thank you. I think everybody in the county should take pride in your achievement.
Well, thank you.
Councilman Hager.
Thank you, Chairman. Thank you, Sheriff Hall, for being here today. And I appreciate all that you're doing to enhance the Sheriff's Department. I appreciate that very much. I want to ask a question. What is your census right now compared to what it was last year?
Wow. I can get you the exact numbers, but one of the things that threw us off, as you can imagine, we took the CJC down. That was 800 beds. And so your population hasn't varied much at all, but our bed count has reduced dramatically. And then when we build back, one of the things I think is important is as we were 12 months ago, you had 1,300 beds downtown for inmates. When we finish, we will have 750 downtown, and then the Harding site. And so we reduced the overall jail population when you finish the new building. But our population hasn't grown. As a matter of fact, it's decreasing slowly over the last 10 years. So we expect to need fewer beds going forward. I hope so.
And are you monitoring the ankle bracelets and stuff of that nature, or is that to probation department?
Yes, probation does mainly.
And now, as I understand, what is the plans for Blackwood down the street?
I'm not sure what the mayor's office wants to do. Obviously, the city, you guys will decide. But our plan is to move our headquarters, all of our operation, over to what is now the Jerry Newsom Center, the workhouse property, in the next 24 months. The funding for that is approved, and so once we leave, which I think is about 24 months from now, that's a very valuable and important part for someone to decide what to do next. But us and the fire headquarters, the old fire headquarters, of course, are on that property, but. It seems like it could be developed or done, something much better use than what we are.
And what's close to me is, of course, the intellectually disabled, mentally ill people, because my oldest son is
right.
Intellectually disabled, and I used to represent people at Minnesota State on the committal docket. I appreciate you getting the officer certified. Right. Because I got my training the hard way when I was going in to represent people that were on the committal docket. But this building for the intellectually disabled and mentally ill, is it just a separate facility away from the other census or groups?
Yes, it will be built adjacent, basically right next door, so we can share services, laundry, food service. But if we have it the way we've designed the operation, the person would never be booked in the jail, would not be added another criminal charge and so forth. They would be diverted around the system as long as they would complete the mental health treatment assigned by the mental health providers, not by the sheriff's office. Then that criminal charge that historically has gone on top of them would be dissolved or retired. And so the idea is bring us the person. In some cities, that diversion occurs out in the field. Memphis does it out that way, Miami, other places. But here we said, let the police bring us the person and let us divert them once they arrive downtown and provide the services. Right now, or historically, as you well know, that person is booked in jail, fingerprint, photographed, taken to court, put on probation. The number one reason a mentally ill person comes to jail in Nashville, Tennessee right now, number 1, 2, and 3 reasons is they didn't do something we asked them to do. We should have known better than to ask them to do it. I mean, literally, these aren't easy things to comply with. As you know, probation's not easy, especially if you're off your medication. Court dates aren't easy to remember if you've got all. So we really never should have sent that person through those turnstiles, in my opinion. And hopefully this allows us to divert them away from that, and ultimately all they're going to receive is the treatment they need for their illness.
Now, y'all will continue to work, I assume, with the mobile crisis unit and
Right.
also Middle Tennessee
Right.
Mental Health. Is that correct?
Yes, sir.
Okay. As far as the trustees, as your census went down for trustees, I assume it has?
Yes.
Is that correct?
Yes.
Okay. And I guess because the district attorneys are coming up with ingenious ways to keep them out of jail, which helps us all, the cost and everything. Are we keeping any state prisoners at this point in time? I know we used to.
You don't have, you in your county system, meaning that you don't have any state inmates other than those that are in transition within a week or two of receiving their sentence or we're waiting on paperwork, but they're not backlogging or backed up at all.
And I know you've got the pickup trucks for brush. How many of those you got right now?
Oh, gosh. I'd say 3 to 4.
And if you wish for anything, what would it be?
Oh, gosh. You know, I did have my budget request to the mayor's office was about a $1.7 million enhancement. There are 2 things that go on that aren't jail related, don't get a lot of attention that I'm worried about. One of those is that people don't realize we are the front line of the domestic violence situation in Nashville. We serve the civil process on all orders of protection. The number of people taken out on order of protection has increased 50% in the last 5 years. What that really means is people are more comfortable going and having the process work for them. We think that's really good, but the hope is that it never turns criminal, because if you mind the court and you do what you're supposed to do, then we don't have many domestic violence turning into criminal cases. But our volume is tremendously increased, and so I asked for positions to do that. We're the first person to go out, notify someone that you are to stay away from one another. It's a very difficult, dangerous situation. That workload is overwhelming at times, and so we didn't get that request. We also had a few other requests that we put in, but to be fair to everybody in here, the mayor and anyone else, it's an awkward year for us because we're in such a flux of transition the last 12 months, and I couldn't, other than something like that, I couldn't sit here and say that we can't manage the money another 12 months.
So what you were asking for is basically some more people to serve the papers. Is that correct?
Yes, sir. And I'll tell you, I don't believe that number is going to go down. We're building, or you guys are building, a family justice center right around the corner, and to help people who can go and have one-stop shopping for the process of domestic violence, and the Gene Crow Advocacy Center right over here. That's really good news. People are feeling more comfortable going and using the system, but we are in charge of serving all of those OPs that are being issued, and that number is not going to slow down. So we're challenged by getting it done in a real time.
Well, we got the 12-hour hold on them.
Right, right.
I understand that. Thank you, Sheriff. Appreciate it.
Councilman Shulman.
Thank you, Mr. Chairman, Sheriff. And I got here a little bit late, so you probably have answered some of this, but I'll ask you real quick. Grant funding on the Little Grant, $154,000, that's going away from your budget?
The question earlier was, is it going to hurt us being able to do what we have? It's not at all, and you may address that, Pete, as to what.
They took that out of our budget because there wasn't an official announcement that the grant had been approved. We do know that that grant is going to be re-upped. Matter of fact, it's going to increase by about $25,000 as well.
Okay.
So that grant will actually still be in place.
And then let me ask you the question, again, somebody may have asked you this. That revenue drop, it's about $3.8 million that's sitting on the back. What is that?
Yeah, so if you will, $2 million of that was a one-time revenue stream that the phone contract, the phone company years ago, loaned or granted, if you will, the government, and that money was then used to put in some of the equipment. So it's a one-time $2 million. So that's a little misleading. The $1 million though is what I said earlier, where we took the commissions off the backs of the families. There's no commissions being made off of a person who's in jail using the telephone any longer, and that's what that amount would be.
Okay, I got it. Last question: vacancies in your department. It looks like you've got about 883 employees. You know how many vacancies you've got out of that?
Yeah, it fluctuates. We have a class in training all the time, so it fluctuates. We do 4 classes a year of correctional officers, and we're pretty aggressive. We have one of the lower overtime budgets in the government. Work very hard at that by keeping our staff pretty consistent. I didn't say this earlier, but I say all the time, we have one of, if not the lowest turnover rates in the United States. Work very hard at recruiting and training our employees and trying to maintain that person. So we study that a lot, but we don't like to see it get low because that's where your overtime starts to go up.
Well, I guess, so one of the questions I've been asking different departments is vacancies, and you'll probably get that question at some point from Ms. Hayes. Just trying to figure out if you have, if you've got long-term vacancies. If you've got 20 positions that you haven't filled in 10 years, I'd be interested to know that. Okay. But that's what you're going to get, and you're going to get that question. That's what we're looking for.
Okay, good. Okay. Be happy to.
All right. Thank you, Mr. Chairman.
Thank you.
Councilman Vercher. Or we'll put her in the hill. Councilman Glover.
Thank you. Sheriff, if you would, I didn't hear the number, or maybe you didn't say it exactly. If you had gotten your wish list on those additional officers for, what would the number look like, and what would the personnel count be on that, please?
Yeah, so it would have been 4 FTEs, 4 full-time folks, and I think the expense would have been $310,000.
Okay. Given the fact that the grant is, and I know you can't blend those monies, right, but you're showing that money has come out of here. Is there any, will that help free up anything in your budget to maybe make up any of this? I figured the answer was going to be no, but I still wanted to ask it. Okay. All right. Very good. So 310, 4 FTEs.
Yes, sir.
Thank you, sir.
Thank you.
Seeing nobody else in the queue, Sheriff, we appreciate your time.
All right. Thank you all.